Rick.
Hari Om everyone, Hari Om sir.
Hari Om.
So today we have Dr. Satish Pathak sir with us. So Dr. Satish Pathak is MS, FCPS, MNAMS. He's a retired general surgeon from Government ESIS Hospital, Mulund in 2010. He's a yoga consultant at present. Sir is working as an assistant director in the scientific research department in Kaivalya Dham Yoga Institute in Lonavala. Vice Chairman of Indian Yoga Association Maharashtra branch. First to start yoga OPD for patients in Maharashtra. Introduced yoga for the first MBBS students all over Maharashtra through MUHS. Pioneer in starting fellowship in yoga therapy course for doctors at MUHS. Delivered about 1,000 lectures on yoga awareness in India, US, Dubai, Mauritius, explaining about what's anatomical and physiological changes occur in our body while practicing yogic kriyas, that is why you do not get any diseases. Publications which sir has: Yoga Abhyas Doctory Chashmatun in Marathi, Yoga through Doctor's Eye in English, Yoga as Therapy, Medical View, Explanations what are the indications, contraindications and limitations of yoga in each disease, a guide for yoga teacher. And sir is also a yoga recipient of Yoga Ratna Award for the field in work of yoga. So we welcome you, sir, on behalf of SPYK.
Namaste, sir. Namaste. Hari Om.
Namaste, Hari Om. The PPT is visible?
Yes, sir.
Yes, sir.
Okay. May I start then?
Yes, sir.
Yes.
With the prayer, I'll start. Guru Brahma, Guru Vishnu, Guru Devo Maheshwara, Guru Sakshat Parabrahma, Tasmain Sri Guruve Namaha, Tasmain Sri Guruve Namaha. With due respect to Swami Kovalananji, who is the pioneer founder of the Kaivalyadham Yoga Institute, which is celebrating centenary year. It was established in 1924. Dr. Jagdish Naik, who is the organizer, chairman of this therapy course. I welcome all the students who are trying to learn yoga therapy. You have been given details about yoga anatomy by Dr. Manjunath. I will be dealing with the yoga as a therapy. When you have become yoga teacher, how you can use the yoga as a therapy while you are treating the patients. So before going to the details of the therapy, I will just go details about the yoga and little bit of the anatomy, refresh the anatomy, so Dr. Manjunath has taught you, and then I will discuss the one by one chapters with you. So to start with, yoga is an ancient Indian heritage, is today's need and going to be tomorrow's culture. This has been established, people are accepted, and that is why when Honorable Prime Minister, he has put the a statement that we should celebrate International Yoga Day, and it was accepted and signed by 177 countries because they understood the importance of the yoga. Yoga is a 5,000-year-old science. There are a lot of misconceptions about it. People do think it is to be practiced once you retire after age of 60, 70, or to go to the Himalayan ranges and then sit there and do the sadhana. But it is not like that. It is for our people only, family people only. Because problems are there only with the people who are living in the family in the world. Those who are staying in the mountain here, they don't have much problem. Western people, they understood the importance of the yoga, and that is why they are practicing it. Yoga can get practiced at any age. Usually we start after the age of 12. Then 20, 30, 40, 50, 60, 70, 80, whatever may be the age, you can definitely practice yoga and you can keep yourself healthy. The yogic science says, Yuva vruddhoti vruddhova, vyadhito durbalopiva, abhyasat siddhi maapnuti, sarva yogeshva tandrita. Means you might be at the age of 10, 12, 13, then 20, 30, 40, 50, 60, any age, till 100, no problem, you can practice yoga. Then You might be having some disease. Then also you can practice yoga and you can get rid of that disease. So this is a universal truth that yoga can be practiced by anybody. The healthy person can practice yoga to keep himself healthy, and disease patient, he can practice yoga to keep his disease. Either you can totally get rid of it or you can keep it under control, so you will not have to face the complications of different yoga diseases. Yoga changes your attitude towards any event, incidents. You do not react adversely or negatively. The reaction time and the way of reaction differs when you start practicing yoga, and that is very important, because severe and sudden reaction to any action creates problem. So if that is controlled, and that can be done with the help of yoga practices. In fact, by practicing yoga, you can set the biological clock of our body in such a way that it will not go wrong. And if something happens, you can add some more yogic kriyas. Now, sages, those who are practicing, staying in the Himalayas and doing sadhana, austerity, penance, they are doing it for moksha. So they are practicing yoga. Why? Because in Himalayas, in those days, there were no doctors, no Ayurveda person, no homeopathy, no Unani, there was no medical personnel. And if they are practicing their sadhana, and if they get some illness, then there will be disturbance. So to avoid that, they used to practice yoga. And that is why it has got a preventive aspect. Now, currently, the modern man, he still tries to tease or disrespect the yoga. But then he found when he's working in an office, one of his colleagues, he never falls sick, and he at the end of the year, he asked him, how come your all CLs are still pending, still there, or your sick leave is fully there, you are not utilized it. You never fall sick? He said, no, I never fall sick. That's why I have not taken sick leave. He said, how it can be possible? एक हिंदी में कहते हैं ना, अरे तुम कौन सी चक्की का आटा खाते हो इसलिए तुम बीमार नहीं होते हो. So he said, whatever you eat, same thing I eat. Then what more you do? Then he said, I practice yoga. Oh, you practice yoga. That is why you are not falling sick. Okay, so the modern man, he is very selfish man. He doesn't want to go for moksha or penance or austerity. He wants to enjoy all the modern amenities. And for that, you require help. Then he said, okay, I will also practice yoga. And that is how some people are ready to practice yoga. Yoga has got a holistic approach. In 21st century, what we have done as a modern allopathic person or modern medicine person, what we have done, we have divided the human being in multiple pieces. Each piece is treated with separate specialists without knowing what is happening with the other piece. We have got ear specialist, eye specialist, lung specialist, kidney specialist, heart specialist, and every specialist gives his own medicine to one single patient, and then there are problems. But yoga has got a holistic approach. What your yoga practices will be taught to you. Suppose you take a patient. So according to his disease, you design a yoga module, prescribe a yoga module. So that yoga module will work on him so that all the systems in the body that will function properly. All the systems in our body, they are interlinked. Like if you go to some office and some you have got some work to one particular table and that clerk is absent. So you ask the next person, where is this person? He says he is on leave. So you come after 10 days. But in our body, can heart or can lung say, okay, I will take 1 day leave? Can you sanction 1 day leave to the heart? Half a day? 2 hours? 15 minutes? 2 minutes? Anything you can you do like that? You cannot do like that. Why? Because all the organs, they are functioning and they are interrelated. And that is why the yoga practices which are given, they are having effect on the body with all the yogic practices, they will be able to help you so that your all organs will remain normal. So that is the holistic approach we have got. Now, modern lifestyle, why the importance of yoga is increased in 21st century? In 21st century, there is a modernization, civilization, mechanization. A person who is working on some machine in a factory, what he does every day, he will clean the machine. Then on auspicious day like Dasra, Diwali, he will clean it, he'll apply haldi kumku, he will garland the machine and pray for them. Why? Because it is his bread and butter. So that machine becomes his friend. He is working with that machine for last 20 years. But suppose by mistake his hand goes inside the machine. Does that machine says, no, no, he is a very good friend of mine. He made a mistake today. I will pardon him. Does it happen? No. His hand is crushed inside the machine and we have to cut it from the elbow or from the shoulder. Why? Because machine hasn't got mind. The mind has become stubborn in the modern 21st century. The the mind of a man has become stubborn and they are not sensitive. And that is why you are finding on small things, there are quarrels and murders are happening and the wars are happening in the world. So if you want to get rid of all these things, what you have to have, the reaction to the action should be negligible. Then only it is possible. And that is why the importance of the yoga. Another thing important, food habits. In 21st century, our food habits have differed. Every now and then there is a bombarding of TV ads, and that is why our grandson, grandchildren, they are very much fond of this junk food. Now, this is not good for the health. This is one thing. Second thing, if you remember your ancestors or your parents or your grandmother, grandfather, what they used to tell us about eating. हिंदी में क्या बोलते थे? खूब चबाओ, कम खाओ, खूब चबाओ, यही है तंदुरुस्ती का खजाना. Eat less, chew most, that is the secret of the health. But we have turned that, change the proverb also. What is the new proverb? Eat as much as you want. Don't bother about chewing. You can gulp it. That is the era of junk food. खूब खाओ, कम चबाओ, यही है fast food का जमाना. And that is why the problems are occurring. So if you follow, what was the importance of chewing it? See, our in stomach, acid is secreted. And in oral cavity, mouth, the saliva is secreted. Saliva is alkaline and acid is acidic. The gastric acid secreted. So when you eat the food, if you masticate 32 times, that was taught to us by our grandmother, grandfather. 32 times you should chew it. So what will happen? It will thoroughly mix with the saliva. So it will become an alkaline bolus. When it will go into the stomach, that acid, excess acid will be neutralized and you will not get a problem with acidity. So that was the importance of chewing is for 32 times. But nowadays our whole meal is finished in 32 chewing. And that is why this unmasticated food, not properly mixed food, when it goes into the stomach, the problem starts. Then fast life. If you are staying in metropolis like Mumbai, Pune, big cities, if you ask somebody, are you doing anything for keeping yourself healthy? He said, no, I don't have time. I get up early in the morning, catch it local at 7 o'clock, go to the office by 10, then 10 to 5 I work there, then after 5:30 I start from there, again 2 hour journey, I come home at 8:30. I don't have any time. So you don't do anything for your health. That is why this body is like a watch. You have got alarm piece or a hand wristwatch. You do servicing, overhauling, or you have got a two-wheeler, four-wheeler. So every 3 months you do servicing. Why? Because it should run properly. Similarly, this body, all the systems in the body, heart, lung, they also require overhauling. Or this is possible when you do them yogic practices or some uh, practices which will help to keep yourself healthy. But nowadays they don't have time. That is why the health problems are increasing. Then mad race. Am I talking of the race like winter race or rain marathon race? No. I'm talking about, suppose my neighbor has got a 51 inches TV. I should have more than that, 70 inches TV. If my friend has got a small car, neighbor, I should have a big car. So for that, what I have to do? I have to have more money. So I work more, I earn more. And when I earn and I get everything, Gadi, Ghoda, Bangla, sab aa gaya. By the time you are reached 50, and when you are reached 50, either blood pressure or diabetes, they already come and meet you. So if somebody brings sweets, what you say? No, no, you only eat because I got diabetes. I'm not allowed to. Rainy season, somebody says, come on, let us go for a trek. No, no, I got blood pressure. I cannot. So what is the use of this earning? You earn a lot. You got all facilities, but you are not able to enjoy it. So when you are trying to earn, that time, same time, if you start practicing yoga to keep yourself healthy, you can enjoy the facilities which you will get because of the earning. Speedy, effortless earning. This has become a very common funda nowadays. People are interested in earning money without doing any physical exertion or any job. That is why we every now and then we read in the paper this scam, that scam, that scam. Why? Because people are doing this unethical. So all these things, these are because of the modern lifestyle. If you want to get rid of it, you should start practicing yoga. I'll just give one example of the speedy, effortless earning. One of my colleagues was working in government office and he's joined yoga and we are practicing yoga. At the end of 3 years, when we are just discussing what benefit you have got, what changes have occurred in you. So he said, I noticed one change. He said, what happened? He said, I'm working in a government institute. So if I'm deputed to go to some other place, if it is possible to go by bus, I used to go by bus, but I used to put the bill of cab fare, taxi fare previously. But after coming in the yoga, now my mentality has changed. So if I go by bus, I put the bus bill only, not the cab bill. So this difference, this mentality changes. And if such a divine man is produced because of the yogic practices, what will happen? He will be a good man. Yamaniyam, if he is following, he will be decent man. And if such decent people are there in one society, that society will be good. And the nation will definitely progress. And that is why yoga has got a very broad base. It is not just only at physical level, it is at all levels. Now, 21st century is called century of tension. When there is tension, what happens? Disturbed mind and mental stress. It causes diseases like diabetes, hypertension, myocardial infarction, obesity, constipation, asthma, psychological problems. Now you must be knowing that malaria is caused by some organism. Typhoid is caused by some organism. But is there any organism which is causing diabetes, hypertension, myocardial infarction, obesity? No, it is caused by mental stress. So the 21st century is causing these diseases And we have given a very good name to this, lifestyle disorders. Now, what is the peculiarity of these diseases? These diseases, they are not totally curable. Once any person is diagnosed as a case of diabetes or as a case of hypertension, and if he started with medicine, he has to take medicines all over the life. And as age advances, the disease goes on progressing and more complications they come. That is why these lifestyle disorders, they are the boon of the modernization of the 21st century. In olden days, these are all non-communicable diseases. About 50, 100 years back, it was because of the communicable diseases like smallpox, cholera, plague. Now, modern medicine has conquered all these diseases. So, Almighty has sent this, or modernization has sent this non-communicable diseases, lifestyle disorders. And as these are not totally cured with the help of modern medicine, all over the world, people are searching for the alternative for this costly allopathic medicine. And they have found a way, and that is the yogic way. You go to any country, the most modern country, you can see America or Japan or Germany also, you will find that there, those people, they are practicing regularly yoga. They have understood the importance of the yoga, and that is why they are practicing. If you come to Kaivaladham Institute Lonavala, which is the first yoga institute in the world, you will find 50% of the people they are from other countries. Why? Because they understood the importance of the yoga, and that is why they are coming all the way from their country to India to learn yoga. Now, behind every disease, there is a cause, and no drug can reach that cause, and that is mind. As we have seen, all these lifestyle disorders, they are caused because of the mental tension. And this mental tension goes and have the effect on mind. Is there any medicine for this? Otherwise, all these diseases would have been cured completely. But no, there is no cure. But yoga has got the effect. And that is why the importance of the yoga. Now, currently, medical expenditure has gone up from few hundred rupees to few 100,000 rupees. When I was a child, I remember in 1960, 65, or in 70s, 80s also, the medical expenditure was in few hundred rupees. But now it has gone to few hundred lakhs, 1,000 rupees, which a common man cannot afford. And that is why they are all trying to find out alternative path. Now, what is total health? The WHO, which has defined total health, it is not just absence of disease, but health should be at the physical, mental, social, spiritual, and emotional level. Now, as a doctor, I'm a surgeon. So if a patient comes to me and if I treat him, I can give him relief only at physical level. But what about mental, social, spiritual? It is not possible. But with the yogic practices, it is possible. That is why importance of the yoga. Yoga has got a preventive aspect. If you go to some medical college, you will find different departments, medicine, surgery, gynecology, pediatrics. Now, in those departments, the patients of those diseases, they come over there, they are diagnosed and they are treated. There is one more department that is called Preventive and Social Medicine, PSM, or nowadays the name has been changed, it is the Community Health Department. Now, what is the function of the Community Health Department? Is to find out the cause of the disease and treat it. Same principle is utilized in yogic practices also. If you are practicing yoga regularly, if you are healthy and practicing yoga, you will not have any illness. And if something happens, you can add some more kriyas. This example I always give. This is a hilltop. People go over here for picnic. And if somebody falls down from here, we have erected a hospital, spent 50 lakhs rupees, and we have got a hospital, all instruments, specialists, and ambulance, and operation theater, and everything. So we have spent 50 lakhs rupees. But instead of that, if you put a fencing over here, which may require only 2 lakhs rupees, nobody will fall down, and you will not have to have such a big hospital. So this is the preventive aspect. Similarly, if you practice yoga regularly, you can keep yourself healthy and you need not have to take any medicine for any disease. Now, yoga can be used at preventive, curative, adjuvant, and palliative. Initially, yoga was never used as a therapy. The sages, those who were practicing yoga, they never thought of it because it was a preventive aspect. But currently, modern person, he saw that, oh, if I practice yoga, my diabetes comes under control. If it is a recent, it totally vanishes. So this angle has been added to it. And that is why in last 50, 70 years or 80 years, yoga has been used as a therapy. So how can you use it? So it can be used as a preventive, curative, adjuvant, or palliative. Now, preventive, we have seen the sages were practicing yoga and they were keeping themselves healthy. Similarly, suppose you are at the age of 30, 20, and you are not having any disease till now. If you start practicing yoga, you will not get any of this lifestyle disorder. So this will be preventive. Now, curative. Curative means where you can totally cure the patient. Now, the most important are the non-communicable diseases like diabetes, blood pressure, heart attack, obesity. Now, all these diseases, if they are of recent origin, means suppose somebody has got diabetes just 2 months back or 6 months back, or just detected blood pressure about 5 months back. Now, this person, if he starts practicing yoga regularly, as per the advice and under the guidance of yoga teacher, he can get rid of diabetes. He can totally stop his medicines. So here it acts as a curative. Then adjuvant. This is very important because nowadays, if you are reading the newspaper, you must have read quite on and off the news always come. In 2014, a random blood sugar level survey was done across the metropolis. And it was found that 66% people, they are undiagnosed pre-diabetic condition. Means they are on the borderline of diabetes. Any day they can become diabetic. WHO, they have published and they have said that at present there are 366 million people suffering from diabetes all over the world. And by 2030, it will become 566 million people. And maximum people, patients will be in the developing countries like India. India will be a diabetic hub by 2030, and every fifth person will be diabetic. So how bad the disease is? So here, if now somebody has got diabetes 20 years old, 30 years, 40 years, and if he comes into yogic practices, he can curtail the dose. Suppose he is on 4 tablets a day. By practicing yoga, it can come to 2 tablets a day, and he will not face any complications. So here it is an adjuvant therapy. And next, last is the palliative therapy. Palliative means sometimes you must have heard that patient comes to us in the hospital, we treat him, and at one step, what we say, you can take the patient at home, nothing more can be done. You just cross your fingers and pray the God. So whatever remaining life is there, you can make it little bit comfortable. That can be done with the help of yoga, and that is the palliative. So these 4 ways you can give yoga practices to the patient. Now, before going to the details of the yogic practices, what are the precautions while practicing yoga for healthy person? Now, you must be knowing all that the best time is the Brahma Muhurta, that is 4:30 a.m. in the morning. If it is not possible, whenever you get up in the morning, do it. at least 45 minutes you don't take any breakfast after the yogic practices. That also, if it is not possible, suppose you have got shift duty, you can do it any other time, provided your stomach is empty, or if you have taken light lunch, you can do it after 4 hours or after full meal. At least your stomach should be empty. You should feel that now I'm feeling light, or at least not less than 6 hours after that. Yoga sadhana is not an exercise. It should be practiced in a yogic way. And it should not use the force. बलपूर्वक करेगा तो बल हानि होगी. इसलिए you have to practice it as per your capacity, individual capacity. You should not force yourself. Suppose two new people join the yoga class and the teacher tells you to sit into Vajrasana or Padmasana, and you are sitting in Vajrasana, Padmasana, and then after 5 minutes you are getting tingling numbness into the both the legs. Then you see this side, oh, he's sitting comfortably. So you also sit, you are getting numbness. But you said he will laugh at me, so he's tried to sit it. So this should not be done. You should do it as per your capacity. Today you might not be able to sit for more than 5 minutes in Vajrasana, but after 8 days, 1 month, 2 months, you will be able to do it. So do it as per your capacity. Then another thing, you are going to be yoga therapist. So one should not practice one single asana or kriya, but whatever yoga module which is advised. So many times now you will get the patients like that. Am I audible? You will get the patients like that. You tell me one single asana and I will practice it religiously. Because it has got a holistic way. So only one single asana will not help. So whatever practices are given, they should be practiced regularly. But should not try to reach the final stage of asana on the very first day. If you are practicing yoga, on the very first day, you should not try to reach to the final stage. Like Kapalbhati, suppose you are asked to, you can reach up to 100, 121 stroke. So first day, you should only do 20, 30 as per your capacity. Or asanas also, you should not try to do the final stage of the asana on the very first day. One should not practice yoga when you are tired. Then ladies should not practice yoga during menses. In pregnancy, yoga can be practiced, but it is under the supervision of expert yoga teacher who has practiced and given yoga practice to the pregnant woman for last 5, 10 years. You work with him for some years, then you can give, because pregnancy is very precious for any woman. And there should not be any mistake. By chance, if you try to do something vigorously and if she aborts, then you will be a problem and yoga will be blamed. So you should practice first with the yoga expert teacher for some years, then you make do. Then one should not practice yoga by just reading the book or watching the TV or practicing somebody. Now coming back to the yogic practices, what are the needs of the body? What is the priority wise? The first very important is the air, second is water, and third is food. But we have changed this priority also. What you have done? First is the food. Whatever you get, you will eat. Water, you may drink later or you'll tell no place. And air, there is no place at all. But if you follow the regime, what we teach in yogic practice, make 4 parts of the stomach, 2 parts for the food, 1 part for the water, and 1 part for the air. And then also you practice yoga simultaneously, you can keep yourself healthy. Our human body is a wonderful human body. Heart and lung, they are non-stop pumping set. I told you, can you give half day casually 1 hour, 15 minutes to the heart? No. They are non-stop pumping station. They have to work continuously. The day you are born till your last breath. So try to have some mercy to both of them. And for their rejuvenation, for that you have to give some time. And that is you can do with the help of yoga. Eyes, they are like camera and projector. Ears, the sound system. Whatever you are listening, you are able to memorize it because of the able to hear through the ears, and it goes and gets memorized in the brain. Stomach and intestine, Urcha, chemical laboratory. Whatever you eat, whether it is good, bad, junk, it tries to digest it. Nerves, miles of communicating system. Suppose I close my eyes and put my hand like this, and if you put something on my hand, I will palpate and say, yes, it is mobile or it is pen like that. How? Without seeing, I am able to do it because the sensation, each and every part of the body has got a nerve sensation. And it sends messages, and memory tells it, yeah, it is pen or it is mobile. Mind is an unparalleled computer with infinite capacity. We boast ourselves that we have got computer, computer, mega computer, but nobody can beat this computer. It is a super duper mega computer. And the greatest thing is unbelievable coordination amongst all of them. And yoga tries to maintain it. And that is why the importance of the yoga. Yoga is also a science and not a mystic. Lot of people, they think yoga is a chamatkar. Chamatkar nahi hai. This is also a science. I will give some examples of it. Now, central nervous system, this is the brain and this is the spinal cord. Now, what are the functions of this? Sensory system means collect the all sensations from all our body. Motor system means have the action. Autonomic nervous system and memory. Whatever I am telling, you are trying to remember and use it whenever it's necessary. Now, sensory and motor system, they work hand in hand. Now, this is the cut section of the brain. This is small part controls the different parts of the body. Suppose there is some bleeding or hemorrhage over here, what will happen? This part will not function properly, and the part of the body which is controlled by this particular small part gets paralyzed. So if you might have heard that one of your neighbor, he was admitted, he got a stroke and he has got a right side paralyzed. Why? Because when there is a hemorrhage or bleeding into the left side of the brain, there is a right side paralysis. When there is a right side hemorrhage, there is a left side paralysis. You must be knowing that the brain controls the opposite side of the body. Now, this is the cut section of the eye. This is the lens, and this is the conjunctiva. This is the retina. If somebody stands here in front of you, the image is formed on this retina and message is sent from here to the brain that your teacher is standing or your boss is standing in front of you. So what happens immediately? What to say? Good morning, sir. How you say? With this help of motor system, the muscles of the hand are activated. You fold your hand and you say good morning. Suppose this is the cut section of the ear. This is the eardrum. Suppose somebody calls you from the right side. The vibrations, they reach over here, and from this nerve, message is sent to the brain that somebody is calling you from right side. So what you do? With the help of motor system, the muscles of the neck are activated, and you turn your neck on the right side and see who is calling you. Suppose you are eating something, whether it's eatable, not eatable, spicy, stale food, the message is sent to the brain. And if it is stale food, what you say? Don't eat it. What we do? With the help of motor system, muscles of the hand are activated. You pick it up and throw it into the dustbin. So the sensory and motor system, they go hand in hand. Third system was autonomic nervous system. What is the function of autonomic nervous system? It has got two parts, sympathetic and parasympathetic. Now, sympathetic, it is activated when there is a flight or fight mode. Suppose you are too much under stress, if you are frightened, that time sympathetic activity is more. And when sympathetic activity is more, adrenaline is secreted. So the respiratory rate increases, heart rate increases, secretion of endocrine glands increases, and blood pressure will go up, pulse rate will go up, and there will be problem. But when parasympathetic is activated, your mind is cool, pulse rate is normal, blood pressure is normal. And if all the systems are functioning normally, if blood pressure is normal, heart rate is normal, blood sugar is normal, you are healthy. So when it is possible? When the sympathetic activity is less parasympathetic activity is more. And it is possible because how it acts whenever, suppose something bad news comes to you or some frightening news comes to what happen? It goes and hits over here, either by ears or by eyes. You see that, and when the brain notice that, oh, there is no fire in front of your house. So what happens? If I stay here, what will happen? That fire will come and I will be having problems. So I want to run. So either you want to run, so you have to run, or suppose you are a person, yes, I will see that how it, so what you will do, you try to extinguish that fire. So you will work over there. So for the both the things, your body has to work more. So sympathetic activity increases. Now how it increases? The hypothalamus is activated whenever there is some uh, calamity like that. Then it secretes corticotropin releasing factor CRF, which goes and acts on pituitary gland, and it secretes adrenocorticotropic hormone, which goes and acts on the cortex of the adrenal gland. Adrenal gland is situated over where it is situated. Anybody? One of you can tell me? Yes,
Kidney.
over the kidney. Top, right, correct. So it goes and activates the adrenal gland and it secretes cortisol. Or in another pathway, it goes and acts the locus ceruleus. This is the part of the brain which secretes epinephrine and norepinephrine. They go and acts on the organs, and that is how the pulse rate, blood pressure increases. Now, when this is a natural defensive body mechanism, or it is called fight or flight response. So their heart rate increases, blood vessels constrict, blood pressure increases, respiratory rate increases, blood sugar increases. Why blood sugar increases? Because either you are running away, you are trying to extinguish the fire, you have to work more. So you require more energy. So more sugar is released. So your blood sugar level goes up. That you must be knowing, that is called stress diabetes also. But when parasympathetic activated, what will happen? Blood pressure comes to normal, respiratory rate comes to normal, blood sugar level comes to normal, and you are calm and cool, sound person. So we have to achieve the sound mentality so that the reaction to the action is reduced. And it is possible with the help of yoga. Now, another important thing, 1 minute. Another important thing that yoga is a science is you must have read about chakras, isn't it? These are the chakras situated in the body. Different names are there. You must have learnt all that. Are they imaginary chakras? Sages are written book, we are read, and then we are telling you that here is Ajna Chakra, here is Vishuddha Chakra. It's not imaginary. It is there in the body. I, being a surgeon, I must have operated on total body for thousands and thousands time because I was practicing surgeon for 45 years. So I read one of the book in the author has written in 1920, and I picked up this from his book. He has correlated the chakras with the modern medicine. Now this is the Muladhara chakra, which is situated near anal opening. It is called pelvic plexus from allopathic point of view. This is the allopathic depiction. When we saw, we found it like this. And this is the yogic depiction drawn by the sages. How many petals are there? 4. What is the importance? I will tell you later on. So Adhishtan chakra, this is aortic plexus from medical point of view. This is the medical depiction when we saw as a surgeon. And this is the yogic depiction. How many petals are there? 6. Manipur chakra, from medical point of view, it is called solar plexus. This is medical depiction and this is the yogic depiction. Petals are 10. Anahat chakra at the center of the chest, it is called Anahat chakra, cardiac plexus from medical point of view. This is the yogic depiction, and this is the medical depiction, and this is the yogic depiction. How many petals are there? 12. Vishuddha chakra, which is situated in the neck. From medical point of view, it is called cervical plexus. Medical depiction is not shown over here. This is the yogic depiction. There are 16 petals. And finally, the Ajna chakra, which is situated at the center of the forehead. From medical point of view, it is called optic thalamus or optic chiasma. This is the medical depiction, and this is the yogic depiction. How many petals are there? 2. How many branches are there? 2. Similarly, the previous chakras, when there are 10 petals, 16 petals, 4 petals, we found same number of branches. That means sages were knowing the human anatomy and physiology, and they have studied in such a way that you can correlate it with yogic practices, and you can also experience it. This is the vertebral column, and this is the chain of the plexuses or chakras. And from here, the different nerves start and they supply to the different part of the body. Which are they? This is the eye, this is the heart, this is the lung, then this is the salivary gland, stomach, liver, then spleen, then these are the small intestine, these are the large intestine, and this is the kidney. All these organs are controlled by the chakras through these nerves. Now, suppose somebody says that I had gone for a party yesterday and I had little excess food. So today morning I skipped my breakfast, and in the lunch I just took curd and rice. Why? Because I had the indigestion. Problem was in the stomach. Somebody has got a heart attack. Where is the problem? Problem in the heart. Somebody has got asthma. He has to use that nebulizer. Where is the problem? Problem is in the lungs. Somebody's kidneys are damaged. He has to undergo dialysis. Where is the problem? Problem in the kidneys. Means if any one of these organ is not functioning properly, you are called sick. When they will function properly so that you will be healthy? When the control is proper. When control will be proper? When all these chakras are functioning properly. And to activate these chakras and to make them function properly, we do Omkar. How we do Omkar? We breathe out totally, then breathe in, and then Om. The vibration generated by this Omkar, they go on activating all the chakras. Chakras are functioning properly. The control is proper. All organs are functioning properly, and you are healthy. So that is the importance of the yoga. If you type on the Google, Dr. Herbert Benson, you will find he is an American scientist. He has done research on Omkar. And what was his conclusion? Omkar a day, keep the doctor away. If you practice yoga regularly, all the chakras will be activated, control will be proper, all organs will be functioning properly, and you will be healthy. So that is the importance of the yoga. Another importance about the yoga is a science. This is the structure of the heart, and this is supplied by this coronary artery. Heart supplies blood to whole of the body, all the organs in the body. That is how they are functioning properly. But this heart also requires blood for its functioning. Na? So it is supplied by these are the coronary arteries. And this is the internal structure of the heart. This is the atrium. These are two atrium. These are the ventricles. This is the aorta, and this is the pulmonary vessels. Now this pump, if it is functioning properly, the distal part of the body, this far away part of the body, they will get proper blood supply. If this pump is not functioning properly, what will happen? this part, this part, this part may not get blood proper supply, and then there may be some disease. So if you don't want to have any disease, because why these blood vessels are necessary? Because the artery, which carries the pure blood, which carries the oxygen and all the nutrients required for the cell. So all the arteries should be functioning properly. Now, what are the functions of the vein? Veins collect the waste matter from the cell. So they will collect carbon dioxide, they will collect the end products of the protein, carbohydrate, fat metabolism. So arteries should function properly and veins should function properly. Now this is possible if heart is functioning properly, the circulatory system is working properly, then it is possible. But if it is not functioning properly, what will happen? There may be some block into this coronary artery. And when there is a block in the coronary artery, what happens? You can see this part has become totally dead. It is black. And then we say that he's got a heart attack, myocardial infarction. And this patient then is admitted into the ICU. Then we do stress test. If it is positive, then we do angiography. If there are blockages, then we say, oh, we have to do bypass surgery, for which we require about 3 to 4 lakh rupees. How the blockages are, look, this is the coronary angiography. You can see this artery has become narrow over here. If you see the angiographic picture, this is angiographic picture. This is one coronary artery. This is another coronary artery. And this is one block from here to here. And this is another block. You can see the date, 9/5/95. And then he practiced yoga with me. And then after about 11 months or 12 months, again angiography was done. And you can compare this block to this block. And this block to this has totally vanished. And the length of this block has reduced to this side. And he has never undergone bypass surgery. Another example, this person was having single block. So he was advised to go angioplasty, balloon angioplasty. You must be knowing now the stent is paid, medical stent, medicinal stent. So he also practiced yoga with us. And after 1 year, he has repeated angiography and that block has totally gone. And he has not undergone angioplasty or bypass surgery at all. So I treated 1,800 patients with the help of yogic practices, those who are having myocardial infarction or heart attack. And they are, barring one or two, nobody has undergone bypass surgery. So this is also a science. This is not a mystic. ये चमत्कार नहीं है. If you practice yoga regularly, you can bypass the bypass surgery also. Then currently, I told you that diabetes is most important problem for the current era. This is one of the example I'm quoting here. The fasting sugar was 207. Then postprandial, 2 hours after lunch, it was 353. And he was on tablet Dionyl 1 BD, one in the morning, one in the evening. And he started practicing yoga. And subsequent, you can see here, the postprandial was 119, 2 hours after lunch. You might ask me that you might have increased the medicinal dose. So you can see here, Dionyl 1 BD means 1 in the morning, 1 in the evening. Then it came to 1 OD means once a day. And after that, no medicine at all, no medicine at all. That means if you can practice yoga regularly, you can keep yourself healthy. If it is a recent origin illness, you can totally get rid of it. Now, you have gone through these important aspects of the yoga. So what practices you can do? You must have learn all these practices. So what we'll do now, we'll see what benefits you get, what anatomical, physiological changes occur in our body when you are practicing different yogic kriya. So we'll start with Jala Neti. I hope everybody must have practiced and everybody must be knowing the theory. Anybody doesn't know? Everybody has practiced? Just raise your hand. You have practiced. Okay. So here, this is a neti pot, and we have taken lukewarm water, and we have added little salt into that, and then we apply the neti pot in such an angle that water will go in, and the neck position should be also like this. That water will go in from this side, and it will come out from this other side, other nose, and then you do it from the other side also. So this is a Jal Neti. Those who are practicing Jal Neti, as a teacher, you can study the advanced study also, and that is Vastra Neti, that is the rubber Neti, and that we'll discuss it later on. Now, what benefit you get by doing Jal Neti? First, you understand the anatomy of the nose. Now, this is the one side of the nose. Inside this, there are three turbinates. As you have got platform in the kitchen, kadappa platforms to keep utensils, it is like this. And this is the mucous membrane covering it. Now, this is the sinus. This is one sinus. This another. There are two sinuses here, frontal sinuses, two maxillary sinuses below the eye, and two ethmoidal sinuses just inside the inner angle of the eye. Now, what is sinus? Sinus is a small empty room which is lined by mucous membrane, and this mucous membrane secretes little water every 24 hours, and this water cleans these walls of the sinus, and this dirty water is thrown out through this window into the nose. Now, this is the frontal sinus, this is the maxillary sinus. Another important aspect of this sinus is the mucosa of this sinus, it secretes nitric oxide. This is bactericidal. Now, when you are practicing Jal Neti, when you normally what happens, you get infection. How you get? Suppose you stand close to the person who has got a upper respiratory tract infection, allergic rhinitis, running nose. So when he's breathing out and in and out, those bacteria he's throwing out. And same you are inhaling. And that is why you get the infection. Now what happens? When those organisms, they come and stay over here, there is an allergic reaction by this mucosa, and that is why you get running nose. And then once the infection is set, you get allergic rhinitis. Now this kadappa, the covering of the mucous membrane, it is very sensitive. Now, what benefit you get by doing Jal Neti? When you do Jal Neti, the lukewarm water goes in from this side and it comes out from the other side. So it cleans whole of this passage. The mucous membrane is cleaned. Whatever dust particles are there, they are thrown out. Now, what I told that you are standing close to a person who has got running nose. He is throwing out the virus into the air, and same droplets of dust particle you are inhaling, so they come in your nose. So it comes along with the dust particle. If you are doing Jal Neti, what will happen? All this mucous membrane is clean, whatever dust particles they are thrown out. So when they are thrown out, along with that, the virus, bacteria which is there inside that is also thrown out. So chances of getting infections are reduced. That is why, if you remember, in Corona period, Jal Neti was advised. The benefits of Jal Neti was given on the WhatsApp by so many doctors that it helped, because whatever coronavirus you are inhaled. Another thing you must be remembering, the first basic principle was social distancing. 6 feet की दूरी रखो. Why? Because when some corona person is exhaling, he is throwing out the coronavirus. And if you are very close to him, same you will inhale and you will get infection. But if you are 6 feet away, those dust particles, they will settle down on the floor and chances of you inhaling that coronavirus are reduced. That is why the social distancing was there. Then if you do Jal Neti, all these dust particles are thrown out. So chances of getting corona infection was less. That's why it was advised to the people who are working along with the corona patients in the hospitals, or social workers who are working with the corona patient. They are advised to do Jal Neti when they will go home. So whatever viruses they are inhaled while working with those people, by doing Jal Neti or inhalation of the steam, you must be remembering there those days, the people are asked to get that steam machine, so that moment you enter the home, take the steam. Why? Because it kills the bacteria and viruses. So if you are practicing Jal Neti every day, all the bacteria viruses will be killed and you will not get infection. So that was the benefit of the doing Jal Neti. What was the another benefit? This mucosa, when there is a infection, allergic rhinitis, what happens? The mucosa swells. There is the edema, swelling of the mucosa. There is a water logging. And that is why if somebody has got allergic rhinitis, you ask him, what is the problem with you? Oh, I got running nose, allergic rhinitis, and my right nostril is blocked. Why it is blocked? Because the mucosa lining inside, it has swollen. That is why, suppose this is the mid septum and this is the lateral side. Now this inside and this inside, if that mucosa swells, what will happen? The space which was this much in normal person, it will reduce because of this. So what will happen? The air going inside will be less. Now this swelling is because of the reaction of the mucosa to the virus or bacteria. So there is a water logging, swelling of the. Now, what we are doing in the Jal Neti, we are taking lukewarm water and we are adding little salt to it. What is the peculiarity of the salt? If you put the salt on the table in a small utensil, in 2 hours, what will happen? It will become wet. Why it becomes wet? It absorbs the moisture from the atmosphere and that is why it becomes wet. Similarly, when you are doing Jal Neti, the salt which is there into the Jal Neti water, it will absorb the water from the mucosa. It is because of the hygroscopic action. So what will happen? The water into this mucosa will be absorbed. So the swelling of the mucosa will reduce, your nasal block will go, the nose will open up. So this benefit you get by doing Jal Neti. Now water dust particles are there on this opening of the window of this sinus. If it is also washed out, what will happen? This window will not close. If this window doesn't close, the dirty water which gets collected over here because the door is closed, what you get? Sinus problem, sinusitis. If a sinusitis patient is there, ask him what is the problem, what you have got trouble. He said, I feel heavy over here. Why he feels heavy here? Because this dirty water has collected. You can see here dirty water, you can see here also. When he comes to the hospital, what I do as a surgeon, I put a metal tube through this nose inside and puncture this wall and drain out this water. But when I take out the tube, this door will close, opening will close, and again there will be collection. So in allopathy, for sinusitis, there is no 100% cure. But if you are practicing Jal Neti, then this door will not close and you will not get sinus problem. So this benefit you get by doing Jal Neti. Now, when Jal Neti is advised to be done? Anybody? Unmute and tell me. What is the normal ideal time to practice Jal Neti?
Early morning.
Early morning. The reason is because suppose you practice Jal Neti, now when you are putting the water inside, some of the water, it can lingering under this turbinate. And suppose after doing Jal Neti, if you lie down immediately, what will happen? This water will trickle down into the trachea and into the lung, and you may get lung infection. So normally when you get up in the morning, you don't sleep immediately. You don't lie down. That is why morning time is chosen. Suppose you want to do it other time. And also on precautionary measure, always after doing Jal Neti, do 2 sets or Kapalbhati. So what will happen? Water was stuck over here, it will be thrown out. So chances of this water trickling down into the trachea and going into the lung will be 0. So this is the benefit and that is why it is to be practiced in the morning. Now these are the olfactory nerves. The ends of these olfactory nerves, they are underneath the nasal mucosa. What is the function of this? It carries the sense of smell to the brain. whether the smell is good or bad. You must have experienced when you are walking on the road by the side of some hotel and there that person is frying the batata vada. So you get a good smell. Oh, nice smell. But somebody will say, I'm not getting smell. Why is not getting? Because the air coming from the batata vada, when it comes over here, the ends of this olfactory nerve, they sense it and send message to the brain that something frying is going on there. But if there are a lot of dust particles over here, what will happen? The air from batata will come here. But these ends of the nerve, they will not be able to capture that smell. And then he said, I'm not getting smell. But if you do Jala Neti every day, what will happen? All these areas clean, all the dust particles which are there, they are thrown out. The ends of the olfactory nerve, they will be able to get the smell and send the proper information to the brain. So if you are not getting smell, it is called anosmia. So that complaint also will not be there. So this is the benefit of the Jala Neti. So what are the benefits? Clear nasal passage, reduces nasal mucosa swelling, so nasal block will go. Organism with dust particles are thrown out, so chances of getting infection are less. Opens up the opening of sinus, so sinusitis problem will not be there. Fresh nitric oxide production. Now I told you, in the sinus, nitric oxide is produced. When you do normally, this nitric oxide, when it is secreted into the sinus, then it is thrown out through this window into the nose and it mixes with the air which are breathing in and it goes along with this into the lungs. So whatever organism, bacteria are there from here to trachea to the lung, alveoli, it will kill. So it will help to reduce the bacterial load over here and chances of getting infections are reduced. So fresh now, when you do Brahmari, because of the vibrations of that bee humming, there is a 15-fold increase in production of nitric oxide. That is why, if you remember in Corona period, the two things were told by so many people. Even I also put, you can go on YouTube and you can find video. I have given Corona tips. In that, the first was the Jala Neti and second was the Brahmari. Because if you do Brahmari, it has been proved by experiment that nitric oxide production increases 15-fold. And more the nitric oxide production is there, all the bacteria will be killed. So no chances of getting any infection. Then it improves the smell sensation. Then salt added, it gives the antiseptic effect. Then we are using little lukewarm water. So warmness in the nose and sinus helps to kill the organism. So all these benefits you get by practicing Jala Neti. That is why every day you should practice Jala Neti. As you keep a brush and toothpaste on the basin, next to it keep a Jala Neti pot. You are brushed. After that, just do the Jala Neti and come out. After that, you can do Kapalbhati. So water is there, it will be thrown out. Now, such a beautiful thing. Who cannot practice that? The person who has got eardrum perforation. He cannot practice. What he can practice? He can practice Sutra Neti or Rubber Neti. This is the Rubber Neti. You can put through this one nostril. Either you can bring it from other nostril or you can bring out from the mouth and make action like that. So that is a Rubber Neti. Now, why a person who has got eardrum perforation cannot practice Jala Neti? Now this is the eardrum. You can see here eardrum. When you are normally speaking, that sound comes over here and message is sent to the brain. Suppose somebody talks very loudly. What is the first reaction by you? Why so loudly? I am not a deaf. Thoda volume kam karo. Why you say like that? Or suppose you are walking on the road. and somebody comes from the backside and honks the car. What you say that horn. What is your first reaction? You put your hands. Oh, go! I have given you sight, na? Why you put your hand over there? Because the high decibel sound, it comes and hits onto the tympanic membrane. Suppose there is a DJ now. This Ganpati season is there. You might have seen lot of loud DJs are there. You see the person who is handling the DJ. You talk to him offline, means when he's not handling the DJ at home sometime, he will not be able to listen to hear you if you whisper. Why? Because of the high decibel sound, this eardrum cannot accept the low decibel sound, and that is why they become deaf, like, or you have to talk very loudly. Another thing you must have seen, when there is a bomb blast, next day you must have read in the paper that 10 people who are in the vicinity of the bomb blast, they become totally deaf. Now, why this happened? Now, this is the tympanic membrane. When I talk, these words hit on the tympanic membrane and the message is passed through this side to the brain. If somebody talks very loudly, or suppose that car horn is honking, what happens? That highest decibel sound comes and the tympanic membrane curves like this. If very loud sound is there, it will still bend like this. And if the bomb blast sound is there, what happens? It goes through that and it punctures, bursts the tympanic membrane. That is called perforated tympanic membrane. Now, every now and then in a day, at least once or twice, it must be happening that somebody coming with the car, honking the car sound. So what happens? You put like this. But does the tympanic membrane break? No. Why? Because when there is a loud sound hitting on the tympanic membrane, when it becomes like this, when it can become straight, when the pressure of air on this side is equalized by the pressure of air on this side, it balances and your eardrum becomes straight. Now, Almighty has given a buffer mechanism. When there is a bent like this tympanic membrane is bent and the air pressure from this side is more, the air pressure from inside comes here. There is a eustachian tube which opens behind the tonsil in the oral cavity. When such thing happens, when the tympanic membrane is bent like this, the air through the eustachian tube, it comes into this and it comes to the inner chamber of the tympanic membrane and it balances the pressure of air on this side to the pressure of air on this side and your tympanic membrane becomes straight. Have you understood this? Now, suppose there is a perforation. What will happen? Air will come from the ear. It will go through this and come inside and it will come through this eustachian tube. This is a potential space. It is usually closed. It is not open. But when this happens, air will come here, it will remain open. Now, if such a person practices Jala Neti, what will happen? Some of the water may trickle down over here. This is the tonsil over here. And by the side is the eustachian tube. And through that eustachian tube, the water may come to the middle ear. And there may be infection. So the person who has got eardrum perforation, कान के पर्दे में छेद है, वो जल नीति नहीं करेगा. What he can do? He can do rubber niti or sutra niti. Now, who cannot do sutra niti or rubber niti? Anybody? Yes? Any idea?
Those who have tonsils.
Tonsils on the side.
Whose septum is blocked. There is a blockage.
Rubber neti is going from here and coming out from the other side nostril or from the tonsils are right. Yes, somebody said obstruction, right? If there is a polyp into the nose or if there is a severe deviated nasal septum, DNS, so what will happen? The space will be reduced. Or if there is a polyp, what is the polyp? It is a collection of the flesh, maski गांठ है. यदि that it is there and if you try to do the rubber neti, what will happen? It will hit the polyp and it may bleed. So the person who has got a nasal polyp or who has got a very severe DNS, deviated nasal septum, he should not practice rubber neti. He can practice jal neti. But who has got eardrum perforation, he will not practice jal neti. So this is detail about the jal neti. So now you know which patient you cannot give jal neti, which patient you can give jal neti. Now jal neti should be given to all patients. Why? Because all the organs in the body, they require oxygen. Now from where you get oxygen? The lungs. When you breathe in air, that air goes into the lungs and oxygen is taken by the lungs, alveoli, and then it is sent to the body. Now from where air enters into the body? From the nose. So both these air passages should be clean, should be having a normal diameter so that air can go freely inside into the lungs and there will be enough oxygen taken by the lungs so that all the organs in the body, they will get proper oxygen blood supply and they will function properly. So jal neti should be given to all the patients except those who have got a contraindication, which I explained to you. Okay. So this is about the jal neti. Any question? Otherwise, I will go for जलदौती.
सर डीएनएस सेप्टम क्या है?
Huh?
डीएनएस सेप्टम.
DNS. See, these are the two lateral walls of the nose. Okay, and here there is a central septum which separates the left nostril from the right nostril. Okay, understood. Now I will show you. This is the left wall of the nose, and this is the middle septum. So this is like this. Okay. Now, this septum, if it is too much bent on this side, now I'll just again open and show. So, see, this is middle septum and this is the left. There is enough space. Can you see this? Now, suppose this is deviated to one side. What has happened? The space has reduced. So, that is called severe deviated nasal septum or DNS short form.
Okay, sir.
And in surgery, what we do? We excise that cartilage. But then again, if it grows, again the problem is there. So in sinusitis, in DNS, allopathic surgery is not 100% cure. But if he is practicing jal neti every day, kapalbhati, you can definitely get rid of it. There was one patient, one ENT surgeon, who was attending my class. So once he said, sir, next week I will not come for the class. I said, why? No, next week I am getting my DNS operated. DNS comes under ENT surgeon, ear, nose, throat surgeon. So I said, see, your colleague is going to operate and there is no question that waiting list and all that. The day you decide next day you can get operated. So just hold on. Now, since you have joined the class, do it for 3 months. And after that, if you need, you can get operated. He continued our yoga class. I told him to practice Kapalbhati and Jal Neti. And at the end of 3 months, he said, now I'm not having any problem. I need not get operated. So this definitely happens.
ओके सर, वन मोर थिंग. सुबह में उठ के ना देखते हैं नाक का जो पैसेज है पूरा भरा रहता है, ठीक है, और 4-5 नहीं 10-15 स्नीजिंग हो जाती है, छींक आ जाती है, ठीक है, और उसके बाद निकलता ही रहता है। दैट इज नॉट, मतलब वो गाढ़ा नहीं है, पतला है, तो इसमें क्या जल नीति हेल्प करेगा?
Definitely.
अच्छा, मतलब वो उसका क्लियरेंस के बाद में।
Yeah, because uh, how that water running and this happens, this mucosa, if it gets waterlogging because of the, it's not necessary that every time because of the bacteria or virus only it should swell. Because the atmosphere contains lot of dust particles. So those dust particles, when they go inside, there is a reaction by the nasal mucosa to that foreign body. So that is why it swells. So when you get up in the morning, sometimes because you are sleeping and so that water does, when the circulation is there, all this is circulated. So what happens? The swelling doesn't happen. But when you are sleeping, there are no movements. So this water remains over there. And when you get up, then you feel थोड़ा नाक ब्लॉक लगता है. Then थोड़ा sneezing हो गया, थोड़ा brush ब्रश कर दिया. हाँ, now I am feeling better. Why? Because once you start activity, then the circulation improves and water collection was there, it is taken away. So in that case, Jalniti will help. Another question usually asked by the people, that I have got a nasal block. राइट नॉस्ट्रिल मेरा पूरा बंद हो गया, अभी पानी जाता ही नहीं, तो मैं क्या करूं? So what you do 2 sets of kapalbhati, because air requires less space than the water, isn't it? If you are doing kapalbhati, what will happen? This space will open up little bit, and then it will be easy for you to do jalniti.
तो सर बिफोर, मतलब जलनेती से पहले एक बार कपालभाति 2 सेट कर ले, उसके बाद में
बाद में पहले
बाद
नहीं,
में वो जो ये रहता है वो पूरा निकल जाएगा।
निकल जाए.
ठीक, ओके सर, ओके, थैंक यू सर, थैंक यू।
वेलकम.
So I have 2 questions, sir. One question, some people, some kids especially, as soon as they wake up, they sneeze continuously. So for them, will Jala Neti help? Like
What is
kind
the
of
age? What is the age?
around 15 to 20 in that age group.
Yeah. After the age of 13, 14, you can definitely ask him to do Jalniti. But below 10, we should not, because one thing is that they are not matured enough. Second thing, then when you are doing Jalniti, suppose some water goes to this side, that side. One more question I forgot to answer. I will answer it now. So they will get frightened. Another question I will ask you. You have practiced Jalniti?
Yes, sir.
What was the experience on the very first day of Jalniti? First,
The pain over here, a pricking pain.
tingling numbness. Na?
Yes.
Why it happened, you know?
No.
Now, this is the one side of the nose, and this is the olfactory nerve. What is the function of this olfactory nerve? It gives the message of the sensation smell to the brain. So it is habituated of only air coming into the nose.
Okay.
Right? When you are doing Jalniti, the water comes over there and it gets humbled. Oh, water has come. And that is why that sudden message goes to the, that is why you feel tingling numbness. लेकिन अभी करते तो अभी होता है क्या? अभी नहीं होता है ना? Why? Because brain से आ रहे हो जलनीति कर रहे, कुछ नहीं, don't worry about that. So this is the tingling numbness you get on the very first day. But once you start practicing every day, you don't get it. So similarly, these children below the age of 12, those who are not matured, you should not give Jalniti, but you can give mild Kapalbhati. Or sometimes it is difficult to teach them. So what you can do, ask him to do for ऐसा करने को बोलो बस. That's all.
Okay, sir. And the second question is like, my nephew, he has asthma actually. He's diagnosed with asthma, and most of the time wheezing, not wheezing, running nose blockage is there. So some doctors, allopathic doctors, had advised him not to do Jala Neti. So is it the right thing or not? Can he proceed? He feels very relieved after doing Jala Neti though.
हमारे पेट के ऊपर पैर देते हो ना आप, इसलिए नहीं बोलते.
I'm sorry, I don't understand Hindi.
See, if you get relief by doing Jala Neti and Kapalbhati and Ujjayi, you will not come to doctor, na?
Yes. Okay. Okay,
You
sir.
will get relief. Don't worry.
Yes, sir. Thank you, sir.
Welcome.
Sir, I have a question. For the sinus people, is it advisable to press the sinus points before doing Jala Neti?
This space is inside the bony cavity. So by pressing from outside, it is not going to have any effect because you are pressing on the bone. Now this is the bone. Can you see this? And bone cannot be pressed. Bone has got a tough wall. You cannot press it with the hand or with the thumb also. So it won't make any difference.
So the frontal one, this point here, the
See,
eyes.
these are two frontal sinuses. You can see here. This is the frontal sinus. Okay. This is the maxillary sinus over here. And there are two ethmoidal sinus inside the inner canthus of the eye, inside the brain. That's called ethmoid sinus.
Okay, sir.
सर एक और क्वेश्चन है 12 साल से पहले बच्चों को हम लोग जब योगा करवाएंगे तो उसमें से कौन सा नहीं करवा सकते हैं मतलब ऐसा कुछ है क्या
See, there is a debate going on. Okay, what is the ideal age to start yogic practices? We are doing research on that. Initially, it was told that 8 years or 10 years. Now we are coming down to 6 years also. But authentic, we are trying to find out. So we have consulted the child specialist, then we have gone through the scriptures also. So the ideal age is usually after 8. If it can correlate with the old mythological science, those days, the child was sent to the Gurukul for study. It was after the age of 8. Then there are a few more references which says that you can practice it after 8 years. But after 8 years also, first you give them some asanas, then Kapalbhati, forceful exhalation Kapalbhati, no Jala Neti, no Jal Dhoti. Even Agnisar also, you wait for some more time.
सर एक्चुअली क्या है वो शीर्षासन सर्वांगासन ये जो आसनास है ये तो 12 साल से पहले हम किसी को दे भी नहीं सकते ना तो उसमें तो उल्टा इफेक्ट हो जाएगा
See, Shirshasana, Sarvangasana, these are little bit advanced asanas. So they should be practiced once you become expert in the basic asanas.
ओके
तो पहले बेसिक करने दो उसमें 6 महीना निकल जाता है.
हाँ हाँ
Nowadays, for enthusiasm of the people and for making people more curious, छोटे बच्चों को भी शीर्षासन करने को लगाते, but it is not good because the muscles are not well developed. Now, when you do Shirshasana, this whole body is balanced on the base of the skull and these neck muscles. If neck muscles are not developed properly, now this neck is made up of how many vertebrae?
7.
7.
7 vertebrae.
Seven,
Now,
seven.
now these 7 vertebrae and the muscles around it, if they are strong enough, they will hold the 7 vertebrae in one line so that total body can be balanced properly. Now, if the muscles are not well developed and not that strong, patient may have some problem. So it is better these advanced asanas should be taught at a later age.
ओके सर ओके थैंक यू
Welcome.
सर
Anything?
एक क्वेश्चन है मेरा
Hmm.
डीएनएस का जो ऑपरेशन होता है उसके बाद जल नेति और कपालभाति कितने टाइम तक नहीं करना चाहिए या प्रिस्क्राइब करना चाहिए बाद में करने के लिए
For that matter, I always advise after any surgery, at least 6 months you should not do anything which will have effect on that particular part. When we will be learning therapy part, that time all these point aspects will be discussed in detail. Don't worry.
Okay, sir. Thank you so much.
Welcome. I think we'll stop here.
Yes, sir.
Tomorrow 7:30.
Yes, sir.
Sorry, I was late by 5 minutes today because I have got a Ganpati at my home, and every day people are visiting. So one of they didn't get up, so it took 5 minutes for me to come and join the class.
But sir, session awesome tha. Thank you so much. Lots of inputs. Thank you so much.
Welcome, welcome.